I'm going to give you 3 tips about tourniquets that they don't tell you about in school. And we're going to do this in less than 90 seconds. And we're going to call them seasoning tips because they're going to help you become a seasoned provider. Look, I understand that tourniquets look nice and neat in their packaging in the jump bag, but the last thing you want to be doing is screwing around with a wrapper and trying to assemble a tourniquet in front of a bleeding patient. They need to be out of the packaging, assembled, and mission ready. This is going to save you time and the patient blood. Number 2 really messed with me when I went from the classroom to the streets. What they don't tell you is when you put a tourniquet on a bleeding patient, they're happy that the bleeding stopped. However, after a short period of time, they become more and more uncomfortable, more aggravated, and potentially even combative. This needs to be worked into the treatment plan so you can either sedate, give pain management, or drive really, really fast. Number 3, there's actually 2 application techniques, and they both come with their pros and cons. The first is called the hasty or the high and tight. This is where you go as high on the extremity as possible. This is great if you have multiple patients or not enough time to identify where the bleeding's coming from. The second one's called the deliberate. This is the one National Registry tests you on, and it's 2 inches above the wound but never in the joint. It does affect less tissue but may take longer to apply.